Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30+ lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30+ lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. Today, we have the pleasure of interviewing Lauren Castle. Lauren Castle founded and is the CEO of the Functional Medicine Pharmacists Alliance, and she's going to tell us all about what she does, what the Alliance is about, and what their goal is. Thank you for coming here.
Thank you so much. I'm excited to be here for the third year in a row.
What can I tell you? So obviously they love you here.
Yes, and we love A4M. We've had a lot of pharmacists that have started their functional medicine journey over really the last 7 years that we've really been a grassroots organization and movement, and now we're bringing more pharmacists into this space, which is growing so rapidly, and there's such a need for more practitioners.
So describe to us what functional medicine pharmacy is about.
So obviously pharmacists are our medication experts, and we have so many patients that come into the functional medicine or integrative space from the conventional realm on lots of medications. And so pharmacists play a really crucial role in making sure that we're managing those medications and getting the optimal use out of them while we're integrating lifestyle and supplements and nutrition and all the other modalities that play a role in creating optimal health.
Interesting. So are they compounding pharmacists or they're dispensing pharmacists? How do they, just like
there's
you can
all
get
kinds
drugs?
of pharmacists.
So it doesn't matter.
Compounding, dispensing, clinical pharmacists,
Right.
consultant pharmacists. There's lots of roles, and that's what we're really all about, is showing pharmacists all the different options that they have to practice. I think a lot of practitioners assume that pharmacists are doing compounding, which a lot of them do, especially here, and we love that. It's a great opportunity
Like
and
Florida,
something
right?
that's very, very needed. Florida and everywhere. I've got pharmacists all over the country I know that have compounding pharmacies. But there's also a lot of pharmacists that don't do compounding, and maybe they're coming over from a retail pharmacy and trying to figure out, how do I practice functional medicine? So that's where we really try to help teach them, train them, get them the education that they need, as well as work on the business development piece to understand new innovative roles that pharmacists can play in collaborative practice agreements or virtual consultations or practices as well.
That's really great because we need that. So give me an example of, well, first of all, how many members do you have?
So there's about 3,000 in our larger community, as well as about 200 in our membership. So with our membership, the pharmacists actually get discounted modules through A4M through the partnership that we have. So we really love that as a way to get them, again, the training and certifications that they need in order to practice at the top of their scope.
So do you encourage them or do you require them to take the A4M?
It's encouraged, right?
Right.
Because for some pharmacists, there's different training options, but we try to encourage them to really discover what it is that they're most passionate about and make sure that they're getting the best education for that particular niche.
Sounds great. How do they find you?
So we're on fmpha.org, Functional Medicine Pharmacists Alliance on Facebook, Instagram, LinkedIn, all the places.
Wonderful. What made you decide to start this group?
So back in 2017, whenever I first discovered functional medicine, it was through my own health journey as well as my husband's health journey. And I was working as a retail pharmacist, so I really knew nothing about this, but it was so life-changing, and I really felt like this is the future of pharmacy as well, and the way that we should all be practicing medicine or pharmacy or nutrition. And so I started looking for resources on how do I do functional medicine as a pharmacist? And there really weren't any resources. A4M had a few resources, in terms of compounding. Sahar Sweden was one of the first people that I met. Of course, Jim Laval as well.
Right.
Really kind of like the epitome of pharmacists in functional medicine,
Right.
acting at the top of their scope. But it felt like there was sort of a gap there in how to get started. And so we started as just a Facebook group, a really simple way to connect with other pharmacists. Melody Hartzler and Jenna Clack were two of our first members. They're here today at the A4M. So it's sort of like this reunion that we're actually having for the first time since this all started. And from there, it just kept growing organically. We went from 30 members to 500 to 1,000. Now we're up to 3,000, and so we started the membership in 2020 whenever we realized there was truly a need to partner with some of these larger organizations, get the message out there for pharmacists that this is a viable career path for them, and then make it happen in terms of getting more people through the training and education that they needed.
Sounds remarkable. But, I'm going to go back to what you said about your journey and your husband's journey. So tell us about that. Because everybody has a personal story, and it's the personal story that connects us to the path, the career path that we wind up on. So
Yeah,
tell
absolutely.
us about it, please.
So my husband was really the one that was struggling with his health. I felt like I was doing pretty well, but I couldn't seem to figure out why he felt so terrible all the
What was
time.
wrong with it?
Well, we were eating what we thought was a healthy diet
Right.
and discovered an integrative wellness center in Michigan. Did a bunch of different tests, food sensitivities, candida, all the things. So he ended up being sensitive to gluten and dairy, which of course we were
Everybody is.
still eating,
Right.
had no idea. And then candida was a really big driver for him. So we tackled all of those things, and within a month he had already lost so much weight. He was sleeping better, his sinuses cleared up, his gut issues went away, his energy was better. I mean, he was like a new
Remarkable,
man.
right? Magic.
Yeah, and so that was it. I was like, this is life-changing and everyone needs to know about this. So I actually went on to do a master's in nutrition and functional medicine through University of Western States. That was before I knew about A4M, and it was still an amazing program. And so that kind of got me the training that I was looking for, and I just continued to integrate it into my own pharmacy practice, right? In regular retail community pharmacy. And now I could talk to patients about, oh, you're not feeling so good. Have you ever looked into food sensitivities, or have you looked into, what might be going on with your gut? And those were things I would have never thought to talk about with my patients before I discovered it for myself.
Right, because you never would have learned about it, been taught about it anyway. So that's really amazing, and it's the story that actually is the common thread to
Right.
how you find prevention, functional medicine,
Yeah.
and how you do all of that. Anyway, so who are your role models at this point? Who are the mentors that you're using? Because you're also a businesswoman, which I want to address in a second.
Of course, yeah. Well, I mentioned Zahar and Jim, of course. But others, Isabella Wentz is sort of the other functional pharmacist that a lot of people think of. She was one of the first people that I discovered as well. But I think now, there's just so many pharmacists in our community that are all starting to step up and really take on more leadership roles in terms of elevating the profession. So Lara Zakaria is another pharmacist. She kind of calls herself the foodie pharmacist. She's another really inspiring individual that's part of our organization as well. So
that's wonderful. What made you decide to turn to business, and how do you turn this? Because you go from being retail pharmacist to obviously figuring out, okay, drugs are not the only way. I don't want to just count pills.
Right.
I want to figure out a way to help people better, which you did. And now, how do you put business into this?
Yeah, so like I mentioned, there is not one specific way to practice as a pharmacist. There's lots of ways. So whether it's opening a compounding pharmacy or independent pharmacy, starting to integrate wellness programs and functional medicine consultations into a physical pharmacy, or a lot of pharmacists are going the virtual route now. Obviously, COVID really accelerated that path, and so there's plenty of examples out there. I mentioned Melody Hartzler. She and I partner really closely together, and she actually runs a virtual practice that's nationwide for pharmacists called Farm to Table, so
Right.
PHARM.
Yeah.
And so we've got pharmacists in 30 plus states that are able to practice virtually and see patients. And we actually partner with a physician that's licensed in all the states so that we're, again, practicing at the top of our license, but collaboratively as well. And that way, if there's certain lab tests that maybe certain states don't authorize pharmacists to order, we have that collaboration and can make sure that we can get the patient the tests or the products that they need, and even potentially prescribing. So as the pharmacy profession continues to evolve, more and more pharmacists are stepping into this collaborative provider type of role, and that's really helping to alleviate a lot of the primary care shortages and what I think of as the functional medicine care shortages.
Yes.
Yeah, there's a boot camp course that I teach within Functional Medicine Pharmacists Alliance, and it's basically 6 weeks to take a pharmacist from brand new to functional medicine, just the idea of wanting to practice, to actually deciding and coming up with a business plan of how they want to practice. And so through this process, every time we come around to the end of it and we have them talk about their business plan, part of their market research is saying, okay, what's my competition in the area? And are there any other functional medicine providers that I might want to try and collaborate with? And 9 out of 10 people are going to say, there's no functional medicine provider within like 50 miles of me.
Isn't that terrible?
So I'm like, there's clearly a need here, right? We always hear in the news people say, oh, there's a shortage of pharmacists. And it's like, there's no shortage of pharmacists. Pharmacists are done practicing in retail settings that are just really not optimal for patient care. And this functional medicine path is very much underserved, and there's such a need to make functional medicine more affordable and more accessible, and pharmacists are just perfectly aligned to be able to do that.
Sounds wonderful. I think on this note we have to end, because what you said is really remarkable and important. And thank you so much for your work, and thank you for sharing with us.
Thank you so much for having us here.